Hello, everybody, and greetings from Baltimore, Maryland, the home of the Peabody Institute at the Johns Hopkins University. My name is Abra Bush, and I am the Senior Associate Dean of Institute Studies at the Peabody Institute. I'm delighted that you could join us today for Music and Health in the Time of COVID-19, the 8th in our Summer Lunch and Learn series, focused on the challenges and opportunities for remote instruction for music. A special thanks goes to my colleagues in academic leadership at many of the conservatories and music schools in the United States and the United Kingdom for their support for this series. They graciously helped me with this idea and recommended a list of presenters who do excellent work in the areas of remote and online pedagogy. Before we get started, I'd like to thank 4 Peabody staff members who are joining us today and supporting the event. Adam Scalici from Peabody's production team will be in the background monitoring the webinar and working through any technical challenges. Please send comments directly to Adam in the chat if you have them. Patrick Wallen from the Dean's Office, Christina Mansior, and Zane Forshey from Peabody's Launchpad will provide additional support and help me curate your questions. A very special thank you to all of them as well. A few quick notes before we begin. I see some of you have already beaten me to this, which is fantastic, but if you'd please hop onto the chat and introduce yourselves, we'd appreciate it. Please be sure to set the to button to all panelists and attendees so that everyone can see where you're from. We hope you'll consider this an interactive session. The presenters will spend about half of the session on their presentations, after which we will reserve the remainder of the time for questions and comments from you. Please place your comments and questions in the Q&A area of the webinar. We will look there first and will curate those questions and ask them of the presenters. The presenters have graciously agreed to permit us to record this webinar. The session should be posted to the Peabody Keep Teaching website within 1 to 2 business days, should you wish to refer to it again and share it. In addition, they will allow us to post resources and their slide decks. So stay tuned, they're all coming. And now, without further ado, I'm very pleased to welcome our guest presenters for today. Sarah Hoover is my colleague and office mate. She serves as the Associate Dean for Innovation, Interdisciplinary Partnerships, and Community Initiatives at the Peabody Institute. And Jill Sonke is Director of the Center for Arts and Medicine at the University of Florida and Assistant Director of the University of Florida Health Shands Arts in Medicine. Their full biographies may be found on the Peabody Keep Teaching website. Sarah, it's all you. Take it away.
Thank you, Abra, and thank you all for joining us today. In this presentation, Jill and I will explore the ways in which musicians have been responding to the COVID-19 pandemic. All around the country, we have seen musicians reaching out to support those on the front lines of the health crisis, the patients, the healthcare workers, and the communities affected by the pandemic. Jill and I have split the presentation into 2 parts. I will first address the work of musicians in healthcare settings, and she will address music's role in the sphere of public health. We will leave, as Abra said, ample time for discussion and Q&A after our presentations. And please do look for the list of resources that will be posted on the website. So without further ado, my slide is not advancing. Give me 1 second here, there it is. Without further ado, how are musicians doing in the midst of this pandemic? Our venues are shut down. Our teaching and learning have gone virtual, and many of us have been at home in quarantine since March. We have lost performance income, and we are underemployed or unemployed. We feel isolated and alone. We miss being able to make music together. We miss sharing our music, and we miss our audiences. We want to be relevant and of service in the midst of this unprecedented health crisis. In the Barcelona Opera House, the hall opened for a performance to an audience of plants, each of which was then given to a healthcare worker. Despite the fact that tours and seasons are canceled and halls are closed, Musicians have been active, and their work has been picked up by the media as beacons of hope in dark days. Musicians are sharing performances of favorite healing music from their homes. And here an example of Yo-Yo Ma's Songs of Comfort. Musicians are creating virtual ensemble performances to continue to present large-scale works, like this recording of Ravel's Bolero by the New York Philharmonic. Musicians are offering balcony salutes to healthcare workers at shift changes, like here in London. Musicians are serenading those in lockdown from the street, here opera singers in New Orleans. And singers from Atlanta Opera are sending singing telegrams, which are personalized with dedications. Musicians are organizing community music efforts like 10th Intervention's New York City-wide Symphonic Fanfare, which invited trained and untrained players to join in a collective 10-minute work of cheering, reflection, catharsis, and gratitude. And musicians are composing community music from text and musical fragments solicited from people around the world. This email text has become part of a multi-chapter vocal and instrumental work called Broadcast from Home, under the direction of composer Lisa Bielava. Music continues to be recognized around us for its value in our current crisis, but let's remember that music has supported healing since there has been music, and long before there was medicine or music therapy. In the most recent national survey conducted by the Joint Commission, which is the accreditation body for healthcare, it found there were artists in just about half the hospitals in the US. And it also concluded that music is the art most frequently found in healthcare. Here are the highlights of what we know thus far about music's value in clinical settings. It has been shown to reduce healthcare costs. Access to music can result in shorter hospital stays due to faster recovery, fewer complications, and less medication due to reduction in perceived pain levels. Music in the healthcare environment has been shown to promote healing and workplace satisfaction by reducing stress, improving mood, elevating staff morale, and offering positive distraction. Music programs and interventions have been shown to bolster patient experience scores. Overall, music is a cost-effective, even cost-saving way to deliver a range of positive outcomes. Musicians and music therapists together provide a full spectrum of care in healthcare settings, encompassing aesthetic as well as therapeutic aims. While the music therapist works one-on-one with patients to achieve specific clinical goals, the goals of the musician in a non-therapeutic context are to provide positive distraction, to entertain, to offer enjoyment and creative engagement for patients, their loved ones, and for healthcare providers. As defined in 2017 by the National Organization for Arts and Health, the field of arts and health is dedicated to using the power of the arts to enhance health and well-being in diverse institutional and community contexts. The arts and health practitioner uses art to enhance the healthcare environment, to improve patient outcomes, and to increase overall well-being. Providing music in a healthcare environment requires a different mindset from performing in traditional venues. Within clinical settings, there is no stage. Playing at the bedside is not a performance. In the patient room, patients and healthcare workers are not an audience, but full participants. Musicians like this one here, Jacob Lyerly at Johns Hopkins Hospital, serve and support others through their music. And music becomes part of the environment of care. Prior to COVID-19, musicians in hospitals could be found playing concerts in public spaces. Concerts provide patients, guests, and healthcare staff with accessible, uplifting arts experiences. A concert series can feature local and visiting artists and arts organizations, and it can promote a culture of well-being and build community. During COVID, concerts have been virtual, streamed via CCTV, or are held outdoors, like the players in Athens in this photo. Platforms currently being used include Facebook Live, Instagram Live, and YouTube. An organization called My Music RX organizes tiny, intimate concerts created specifically for pediatric patients that take place in the artist's bedrooms. Patients can choose from a wide library of upcoming and well-known artists. This one here is performed by JoJo. Patients can select specific music by choosing a mood they want to feel. Research studies have shown us that patient-preferred music provides the maximum benefit. Musicians like here, Lita Fink at Johns Hopkins, also provide informal music in lobbies and public spaces, where it contributes to the climate of care and enhances patient and staff experience. Passersby are welcome to sit and stay for a while or take in the music as they move throughout the space. Some musical activity is resuming in hospitals as hospitals reopen to visitors, but music can also be delivered virtually throughout the hospital via CCTV or other means. The most intimate form of music making is interacting with patients at the bedside. As current hospital policies may prohibit all non-essential staff from making contact with patients, bedside visits like this one with Jason Hedges at UF Health Shands Hospital are now mostly virtual engagements through Zoom or FaceTime. Arts in health is a maturing field with training programs and academic degrees, professional development opportunities, a code of ethics and standards of practice, and forthcoming certification. Music in healthcare requires specific knowledge for operating in the clinical environment. Musicians like Olivia Raynoff at Johns Hopkins are trained specifically to ensure the greatest possible benefit to the patient with doing no harm. They are also trained to understand that medical circumstances are always the first priority. It is always a collaboration with the patients and care providers. Here, Ricky Kendall at UF Health Shands is making music with a patient, Jamal. The patient gets to drive the interaction. They have the power of choice. Studies indicate that live music seems to confer greater benefit than recorded music. While the circumstances of performing within a hospital can be challenging, working within the healthcare context often provides musicians with a renewed sense of purpose. Artist in residence Tamara Wellens shares that I think that that's why I've stayed in the field of arts and health. I find myself there and it's validating. It really is a richness connecting with people and knowing that I have had a part in their well-being. And musicians have substantial assets they may not know they possess that can be brought to bear in circumstances like COVID-19. Penny Brill, violist with the Pittsburgh Symphony Orchestra, says, with the resources we have available in the form of contacts, visibility, and musical skills, how can we support pressing needs in the community? Can we collaborate in ways that will optimize use of our respective areas of expertise? COVID has shown us even more clearly that healthcare workers see music in their workplace as an important source of solace for themselves and for their patients. Caregivers right now are extraordinarily stressed when there is so little they can offer their patients. Patients, staff, and healthcare providers are asking for our presence and our skill. How then might the worlds of music and healthcare support each other and promote together a stronger culture of health and well-being? Moises Fernandez-Villa, director of the Arts Lab at Boston Medical Center, says, let's be clear, music will not save healthcare, and vice versa, healthcare is not there to save music. But there should be no excuse for these worlds not to meet. And I would argue now more than ever. Now that we have had a chance to look at how musicians are active within healthcare, we're going to return to the world outside the hospital, and I'll turn it over to Jill to discuss music's role in public health.
Thank you, Sarah. I'm going to expand on Sarah's beautiful overview of music and healthcare by talking about the connections between music and health in the context of public health. Sarah, you're doing the same thing yours did. Hang on just a second.
Just hit the cursor and it will advance.
There we go. I want to be that I'm talking health. While illness requires medical support and happens in hospitals, health happens in communities. And more than ever today, health is happening in our homes. So public health is our topic. Until February of this year, many of us were not suggest today that musicians do, among others, but I'll come back to that. We all know that we all know what healthcare is because we utilize it. We go to the places, we go to the people, but public health is less visible and it involves a lot of different types of professionals and practitioners. So I'm going to launch us this afternoon with a little brief 101 on public health. So public health operates on the understanding that we as individuals exist in the context of others, our friends, our families, our communities, and the broader systems and cultures within which we live. Public health also understands that our health is far less dependent on healthcare than it is on social determinants. In fact, the quality of healthcare, while it's important, only accounts for 10 to 20% of our health outcomes. But the social determinants of health, the conditions in which we live, work, play, and worship, account for 80 to 90% of our health outcomes. And today, this emphasis on the social determinants of health is evolving into what's known as the fifth wave of public health, or the culture of health. Within this perspective, we understand that moving the needle on population requires collective action or social change. And that change has to take around the upstream drivers of health inequities, things like racism, collective trauma, and other systemic inequities that drive health disparities. So we know that the arts have long been used as a means to communicate with the public, to influence behaviors, and to fuel social movements. Artists are influencers in communities and have long been agents of kind of social and behavioral change that's needed to populate health outcomes. We've seen this throughout our history, from the explosive expression within the Harlem Renaissance to the AIDS movement in the 1980s and Rent in the 90s, which played a role in reducing stigma, increasing HIV, to knitted pink hats in 2018, and Black Lives Matter today. Public health calls diffusion of innovation with behavior change theory. We call it art. And we see this happening with COVID-19. Today, as so many people reach to the arts, cope with the social distancing and stress of COVID-19, the relationship between the arts and health is more and visceral than ever. Pandemic, the arts in particular have been connection, engaged in recovery and rebuilding as well. Musicians around the world singing and performing from balconies. People are flocking to massive online gatherings like those that Denise and the C and Michelle Obama collaborated on. In these gatherings, experiencing joy and connection, and these artists are using their platforms to take and accurate health information agencies like this. And music has played a significant role in communicating critical health information since February. Over 3.5 million people have watched Neil washing, for example. And Charlie's TikTok dance about being grounded and staying home has been viewed well over 8 billion times. In fact, it was viewed 95,000 times in minutes and over 6 million times in 10 hours. Public health channels don't work that fast to create that level of interest. And collaborative community songwriting, like the Lift Up Louisville project, are providing communities with ways to experience connection in the midst of isolation, and they're pushing those communities to collaborate in recovery and rebuilding efforts. Within this pandemic, music has been engaged for rapid and wide communication by the World Health Organization, by the United Nations, by the CDC, and by the NIH. Agencies who lead our national and global public health systems recognize that music can influence health behaviors for COVID-19 prevention, and that it's essential to our well-being and resilience in challenging times like this one. I want to shift gears now and tell you about a study we're working on in relation to the arts and COVID-19. There's some particularly interesting findings here regarding music that I'll touch on. Dr. Fancourt from University College London is conducting a study to understand the mental health impacts of sheltering in place and activities, such as the arts, that may buffer against negative effects. The Center for Arts and Medicine and Americans for the Arts have partnered with Dr. Fancourt to extend this study to the United States. In the UK, Dr. Fancourt has over 90,000 people enrolled in the study. In the US, we have about 7,000. Weekly reports on the UK findings are available at the link on the bottom of this slide. I recommend that you check them out. They're really exciting. And Daisy reports to the UK government every week on her findings, which represent one of the largest COVID data sets in the UK. So key findings from the UK suggest that across age groups, people miss going to cultural events, and that 81% are listening to music. That's actually more than prior to COVID-19. And while most people are finding ways to engage in the arts at about the same level as prior to COVID-19, 21.4% are engaging more in the arts, and in music more than any other art form. The findings from this study also tell us that younger adults miss the arts more than any other age group, and that appears to be longitudinally associated with better mental health across the COVID-19 pandemic. These findings build on work that Daisy Fancourt, who, by the way, is an accomplished pianist herself, has been undertaking for the past 5 years. Using longitudinal big data sets in the UK, Daisy has found significant population level associations between arts participation and health, including that going to concerts or visiting museums or galleries just once per month or more can reduce the risk of depression in adults over the age of 50 by 48%. Similarly, By doing so just every few months, you can reduce the incidence of disability by 46%. This is a greater positive impact even than exercise. And people who engage in arts and cultural activities live 14% longer than those who don't. These studies are highly controlled, of course, for things like education and socioeconomic circumstances and hold up across all socioeconomic populations. These findings have led to the establishment of social prescribed medical providers and prescribe arts activities like music lessons and choir singing, and the national health system pays for people to participate in these services. I want to wrap up by pointing you to some useful and very timely resources. In November, the World Health Organization published its first report on arts and health, a scoping review of over 3,000 research articles authored by Daisy Fancourt. It's a magnificent resource, and actually within 3 months of its publication, it became the most downloaded report in the history of the WHO. That's how interested the world is today in the connections between arts and health. And over the past 2 years, we at the Center for Arts and Medicine have been working in partnership with ArtPlace America to make arts and public health a thing in the United States. This translational initiative has undertaken a body of research, including evidence synthesis, and has created an array of resources to translate knowledge and evidence into practice and policy. One of the primary resources we've produced is the Creating Healthy Communities Through Cross-Sector Collaboration white paper. This report focuses on 5 key issues: collective trauma, racism, mental health, social isolation, and chronic disease, and offers examples and recommendations for how the arts can address these issues. We've also created an array of resources as a part of our COVID-19 arts response, which includes governmental advisory briefs and an extensive searchable resource repository of the many ways in which artists and arts organizations are engaging the arts to address COVID-19. Today, arts and public health has become a thing, and our public health systems are recognizing and embracing the arts as impactful and evidence-based approaches to well-being, health promotion, and social cohesion, and to building a culture of health in the United States. As this trend continues and as the evidence base for this work grows, the creative sector will have more room to grow than ever and will bring fully to bear the power of the arts to create healthier and more equitable communities around the world. And with music squarely at the forefront of this work and of our attention today, I think we can, in this moment, lift up how music is helping people not only to cope and connect, but also to help reduce instances of COVID-19 and to help us build stronger and healthier communities for our future. Thank you for your attention. I look forward to your questions and discussion, and I'll pass it back to Abra.
Thank you both so much, Jill and Sarah. I want to acknowledge that many of you, including us, are having some connectivity issues today. I've actually been booted off this call twice so far, so I'm hopeful that we can remain somewhat stable and continue this great conversation with both of you. You've done incredible work in this area over the last several years, and so I'd love to sort of ask you just a few questions about how that work is really moving forward during this pandemic. So for either of you and both of you, frankly, how can we approach providing artistic interactions in clinical settings right now? How are you keeping people safe in order to do that, or is it happening at all? And how do you overcome challenges of internet connectivity and other sorts of issues in those settings? So I'll turn it over to either of you and both of you.
Jill, do you want to share from Florida what's been going on?
Sure, I'd be happy to. At UF Health Shands Arts and Medicine, we continue to provide services within the hospital at the bedside, and we've also created a really rich array of remote programs. We were kind of surprised but pleased and challenged at the beginning of the pandemic when our hospital affirmed that our artists and residents were essential personnel in the hospital. And so we took a bit of time away from the hospital because we felt that was in the best interest of safety, and also used that time, about 3 weeks, I think our artists were not practicing at the bedtime. We used that time to develop a really rich suite of remote programs that we call Aim to Connect. So patients can access musicians and residents through the iPads at the bedside. And that was one of the sort of silver linings for us of COVID. We've worked for a long time to get an icon on the patient iPads. There were, prior to COVID, only 3 icons on the homepage of the patient iPad. We always wanted to be the 4th. And when things shifted around COVID, we were actually able to become the 4th icon. So patients can very easily access our services. Nurses can pull them up for patients. And through that icon, they can find archived modules where they can engage in music, guided visual arts activities, yoga, relaxation, and other modalities. And they can request a remote visit with an artist in residence. We also do lots of Facebook Live concerts and events. So we have an array of ways in which patients and community members can access our programs remotely. And our artists now continue to do bedside visits as well.
And I'll just add to that, thank you, Jill, that, it's been interesting to watch your program as you've gone from having to do everything remotely to reintroducing artists back into the hospital. And I'd love to know how can you share a little bit about how that's gone and what the challenges have been there with the reintroduction?
Yeah, so we've had to look at every art form and how it can be, how it can work with social distancing, with masks, music in particular. We have a really strong cohort of musicians in residence, and they've had to adapt to wearing masks and to maintaining distance from patients in those rooms. And really with mask wearing, they just do it. They just sing through. We've also looked very, very closely at the literature on the safety and COVID spread literature, because we understand that speaking with higher volume creates a longer range of spread of the virus. We understand that singing creates a longer range of spread. So we've looked really carefully at that literature and organized our patient visits around the physical distance that's necessary and also the duration of visits. So our visits now for musicians include 1 to 3 songs max in those live visits. We realize that length of time is a really significant safety consideration. It's also been an adaptation for our artists to consider their own safety in coming into the healthcare environment. We recognize, we were talking about this before the webinar, that when we look at the statistics of incidence of COVID-19 among healthcare providers, the vast majority of those incidences are coming from outside of the hospital, social situations and contact outside of the hospital. So we have a pretty good understanding that hospitals are pretty safe spaces. And our artists in residence actually feel pretty comfortable being in the healthcare environment today. We're spiking in Florida, so we continue to reconsider safety. But at this point, as of today, we're still working at the bedside, and our artists are taking all of the safety precautions that other healthcare workers are.
Thank you, Jill, very much. That's a very helpful explanation. I perceive that this is a burgeoning career path, really, for artists and performing artists. Can you talk about, either of you, about what you see in the future in terms of career opportunities for performing arts in the healthcare settings?
I'll start this and then pass it back to Jill, who can speak perhaps to the academic training programs at the University of Florida that provide a pathway. When we look at opportunities for musicians in the world today and growing industries, the healthcare industry is one of the areas working with the aging are 2 areas in which there's just more and more growth and more interest in new tools, new ways to really address the experience of folks in the hospital, the experience of folks living in care communities. So there are increasing opportunities. I don't have the latest data in my hands with regard to that, but there are some. I'm trying to think of the map that you have in Florida. I'm not sure that's the best resource, but that's certainly one that people can look to. We really see that this is an area that we encourage musicians to build skills in and present themselves to healthcare environments in order to really help build programs. And sometimes that process happens for folks who are getting an academic degree in arts and health. And then they have a class project that they need to complete for a capstone, and they go to an organization with a proposal. And on the basis of the effectiveness of that program, the program continues beyond that for the artist. So Jill, I don't know if you want to add anything else as well.
Sure, yeah, I think today we see employment opportunities for musicians and for artists in both the healthcare and the public health sectors. Of course, the public health sector in the United States being the newer frontier. Sarah mentioned a survey in her presentation that determined from data that was collected in 2004 and 2007 that just about at that time, half of healthcare institutions had arts programs. So we presume that to be greater now, but we don't know for certain. But from the perspective of our educational programs, we've had to do market analyses, of course, to look at the potential for employment in this field. Our university commissioned 2 of those, which both determined in 2010 that there was viable employment opportunity in the field. And we've managed to maintain a really vibrant cohort of applications and students in our program. Right now, we've got 80 graduate students, or no, I'm so sorry, don't have 80. We have 60 graduate students in our graduate programs, which include an online MA in Arts and Medicine and an online graduate certificate in Arts and Medicine, as well as an online graduate certificate in Arts and Public Health. We also offer 5 undergraduate certificates at US and 6 combined degree programs for our local on-site students. So we see a lot of students coming to those programs more and more. And we're especially seeing an uptick in applications and interest in the Arts and Public Health program right now as this public health space opens up for us. I also feel optimistic that the work that Dr. Fancourt has done in the UK, and she's published over 60 articles in the past 5 years on the population level health implications of arts participation. She and I have just established the Epi Arts Lab, which is a National Endowment for the Arts Research Lab at the University of Florida, and we'll be undertaking those studies in the US. So I'm optimistic that the results of those studies can yield something at the policy level akin to social prescribing in the United States, where our healthcare systems in some way will support participation in the arts, which will drive, I believe, even greater growth in the arts and health job market and generally in the arts sector.
Thank you very much. There's a question in the Q&A I'd like to ask. You provide arts for the healthcare, do you provide arts for the healthcare providers as well? Is this something continuing during COVID? And what type of arts activities are health providers most responsive to?
I'll begin that, and Jill, if you have anything to add. Yes, absolutely. I would say, with few exceptions, pretty much all of the programs that are designed for patients also have ripple benefits for healthcare providers. Healthcare providers are, at least in my world, the chief champions of bringing this into the environment for the benefit of not only the patients, but themselves as well. I alluded in my talk to how stressed healthcare providers are right now. And that is for themselves personally, the fact that they cannot, there's just a vigilance. A lot of them are working in fields that they don't normally work in. So there are a number of ways in which we design programs to serve them. We collaborate directly with them to find out what are their greatest needs. In working with the nurses at Johns Hopkins, some of the things that have come up have included, could you provide us with musical activities to do with our families when we get back home? Because their downtime at home is so important. And of course, families are, for the most part, locked inside the house. So ranging from that to music for break time and music during just for relaxation, music to have on during, we have performers who actually come in and offer music at the beginning of departmental meetings as a way to set a tone and to create a climate within that meeting itself. We've also developed a creative movement program that is specifically for healthcare providers. So there are a number of programs. When the hospital reopens to visitors, we also plan to have art making classes, so music and dance classes available to healthcare providers on site when it is safe to do so. The Johns Hopkins Hospital is still closed to visitors, so we cannot do that at this time. But serving healthcare providers is one of the main thrusts of this work. And Jill, I don't know if you'd like to add anything.
Yeah, I just have to say, Sarah, I hadn't heard about the opening meetings with music. That's beautiful. I love that. And I just will point to two programs as a model of something else that happens around the country. And that's the University of Michigan's Health Sciences Orchestra and the Longwood Symphony Orchestra affiliated with Harvard. Those are orchestras, really good orchestras, made up of health sciences professionals, caregivers, students, and those programs serve with rehearsals every week as incredible support and creative self-care for caregivers. And they also bring music to their communities. So those are really gorgeous models in this space.
Other examples include making sure that there are practice rooms or pianos available throughout a healthcare system for people to be able to play during downtime.
Thank you both. There is a question in the Q&A around music therapy. And so I know, Sarah, from our conversations that what we are talking about today is definitely not music therapy as the professional field of music therapy has grown up. But the question is, are you including music therapy in your research on the arts in health professions? As a field, music therapy is almost 70 years old and continues to grow rapidly, but it is often overlooked in the broader healthcare arena. So I'd love to hear the speaker's perspective.
I'll just briefly say that most every aspect of the work that we have undertaken at Johns Hopkins has been done in consultation with a music therapist who is just an invaluable member of our team. So that has been really, really important. I think the ideal model here is that there's a full continuum of services that is provided throughout a hospital system and in the public health sphere as well, where musicians and music therapists work side by side, adjacent to one another and collaboratively to build programs and to do the things that each is uniquely qualified to do in a way that benefits, that multiplies the benefits of what we are able to do. I know Penny Brill is on this call today, and Penny's work is through the Music and Wellness program at the Pittsburgh Symphony Orchestra is a really beautiful example of collaboration between music therapists and musicians. And Jill, I don't know if you have anything you'd like to add.
Before we do, Penny, if you are on the call and you'd like to put your website into the chat, please don't hesitate. Jill?
Thank you, April. Yeah, I'll just add to that. It's a really great question. I appreciate it very much. Music therapy as a discipline has been around for a long, long time. And the scope of practice distinctions between the creative arts therapies and arts and health or artist in residence practices is super important. We have on our faculty for creative arts therapists, including a music therapist. So our curriculum is designed by creative arts therapies professionals and arts and health professionals. And at the heart of our curriculum is teaching that scope of practice and distinctions between the two so that artists understand what is in their purview and what is not in their purview, because artists are not clinical care providers. They're artists who know how to navigate the healthcare setting and to provide support and to provide all the things that the arts provide, but they don't provide clinical services. So in regard to our research in particular, some of our research is focused on the creative arts therapies and some distinguishes that practice and focuses on arts practice. But in our research database, for instance, we try, in recognition that the creative arts therapies has a very strong evidence base, we try to bring forward evidence related to arts and health practice, distinct from the creative arts therapies.
Great. There's another question in the Q&A from Dr. James Sherry. Dr. Sherry asked about the recent studies that have been coming out around COVID-19 and aerosol research. I wonder if, and this is for the panelists, so I wonder if you have any touch on that. I will go ahead before you do and just say, we actually did a really great panel discussion last week at Peabody on this called Leading with Science, that is archived also on the Lunch and Learn site. I would encourage you to take a look at that webinar. It was from Wednesday of last week with the folks at Hopkins who have been helping us plan to return to Peabody, specifically about the issues around aerosol. But I'm curious, Jill and Sarah both, if any of that research or any of that work that's going on right now has impacted the work that's been going on in clinical settings in your world.
I'll just say, in response also to your earlier question about where we are with our programming based on the circumstances of COVID-19, all of our program is remote only right now. So we have ducked the issue of aerosols because we're just not, the hospital is not at a place to have live folks come back. Patients are not, even allowed to have one guest with them yet. So we're not there.
Yeah, I'll just say, so I can't speak to the aerosol issue as a health professional, which of course I'm not, but as a program manager, we are looking at that information and we're working with our hospital safety, folks to make sure that our protocols are safe. And as I mentioned earlier, our musicians are wearing appropriate masks. They're very cognizant of volume and trying to hit the sweet spot between keeping volume on the lower side so that the projection of particles and aerosol can be a little bit less and being loud enough to be heard through a mask. But what feels really important to us right now is keeping those visits short and maintaining as much physical distance as we can in the room from the patient. And again, there's sweet spots there that we're constantly monitoring. Is a visit effective if the musician is standing way on the other side of the room and the patient is struggling to hear? And can we provide a service safely? So we actually have a nurse coordinator in our program who triages all of our patient visits, and she makes those sorts of determinations, looks at the physical spaces and makes sure that a visit to a patient will be safe and appropriate.
Thank you very much. A quick question just came in. When you say you're keeping visits short, what are the time intervals for those visits, Jill?
For us with music right now, it's 1 to 3 songs. So we kind of, are trying to stay with it like a 5-minute visit, 5 to 6 minute visit is our target right now.
Thank you very much.
And I'd just add that during pre-COVID times, those visits are also often short as well. They can be, 10 to 15 minutes. So it is some reshaping, but it's not a whole lot of difference in practice. I think some of the main differences in practice have to do with the fact that of the masking, both for the musician, but also for the patient and care providers. It's just more difficult to communicate and to read expressions, and that can be challenging for musicians who've been trained to be very responsive and attentive to physical gesture in terms of reading. Should they continue? What direction should they move towards with their music? And there's just also, and this is even compounded more so when you talk about delivering via Zoom. So one of the ironies of this situation that our musicians are facing right now is after creating a practice of deep engagement and responsiveness with patients. Now, if they are delivering a visit via Zoom and the patient is not able to communicate or unresponsive, they just have to put the music out without having that sense of the interactive, responsive piece. So it's been an interesting pivoting for the artists.
And I'll also add, staff are more critical than ever to those interactions, the feedback that they provide, including for us, our nurse coordinator. And our musicians are also supplementing those visits with Zoom. So they'll often have a first Zoom visit, then have an in-person visit, and then they'll continue that interaction with Zoom or with a blend of the two.
Thank you. How do musicians handle the emotional content of the music in these settings? There's been talk of uplifting emotions, but much music is often touching in darker ways. How is this dealt with in the clinical setting via repertoire choices?
Ooh, boy, big question. So the musicians who do this work spend a lot of time very carefully curating repertoire for these circumstances. And they do that with respect to, I would say in the simplest form, two basic directions. One is uplifting and the other is soothing or calming. So the musicians within their particular genre, and most musicians who do this work across genres, so they have a variety of music to be able to bring to the table. Make sure that they have representative pieces in both of those genres and both of those moods, right? As much as possible, we want the patient to be able to guide the interaction by offering their choice of, if not actual repertoire itself, of the mood, to be able to guide that so that the musician is responding. There are many, many things that one can do musically with volume, with timbre, with tempo, with texture to adapt responsively in the circumstances with the repertoire that they have available. You can play a boisterous "Here Comes the Sun" and you can play a gentler "Here Comes the Sun," right? I chose that song because that's one that's been used often in the New York area hospitals to celebrate the fact that a COVID patient has come off of a ventilator. So Jill, I don't know if you have anything else you'd like to add.
Yeah, just that to come back to the scope of practice, just as an example, music is evocative, right? We have feelings around music. We do as humans, and we have, feelings as humans all the time. And sometimes we need professional assistance with those feelings and sometimes we don't. So we don't feel that having feelings is necessarily unacceptable in musician in residence practice, but a musician in residence does know how to not sort of facilitate catharsis. That's not our goal. We don't want to make people cry. We're not trying to facilitate big feelings. Patient preferred music is, as Sarah mentioned, the gold standard. So if a patient does request a darker song, a musician would use their judgment about whether they, play that song. If a patient cries during a song, a really key difference in scope of practice is that an artist in residence, if a patient cries in the middle of a song, would not stop and say, "Are you okay?" Because that would invite, what feelings are you having? But they would say, "Would you like me to stop? Or would you like me to continue?" And that's one way that they maintain that scope. So you don't sort of veer into all of a sudden a patient is unloading their feelings, which is not the point. You find out whether they continue or not. And our musicians, would refer to another clinical care provider if, you know, and it doesn't happen often, that a situation gets emotionally out of control.
Thank you
And
both.
if I can just quickly add, Barbara Ashton just added a really great comment in the chat that in general, the non-clinical musician, right, that the artist in residence is going to steer things in a way that avoids those more complicated emotions that they are not qualified to address in the context.
Thank you. We have just a couple minutes left. I would love both of you to talk about some very specific work each of you are doing to contribute to the field right now. Jill, I'll start with you. You mentioned that you have been holding a couple of webinar series where you are, and I'd love for you to just say a few words about those and how we can find those if folks are interested in that work.
Sure. Yeah, we've got a few webinar series. We had a series of 6 webinars which are archived. They're recent as a part of our Creating Healthy Communities initiative, and they address those 5 public health issues that I mentioned earlier. We also have a series of webinars related to the arts and COVID-19. And I know, Abra, you're going to share links to those resources. So among our resources are archived webinars related to COVID-19. They really center around social determinants of health largely, but they're there. And we also had a full conference that we live streamed and archived in modules on the arts and public health. So that's accessible on our website as well.
Thank you. And Sarah, I know you've been working on a new book. Can you tell us a little bit about that?
Yes, I would be delighted to. One of my co-authors is Jill, so we've been in frequent collaboration about this. It is called Beguiling Care's Restoring Humanity, Musical Artistry in the in the hospital environment. And we'll put that in, we'll make sure to get that in the chat. It should be published early 21 by Routledge under the College Music Society's Emerging Fields in Music series, and which I'm such a fan of the project of that series and honored to be a part of it. So we address the work of musicians, non-clinical musicians working in the hospital setting. And just to connect this with a few of the questions that came up in the Q&A, what we look at is at all the different ways that musicians bring music into that environment, whether that be in the most public sense of coming to perform some sort of concert and how concert series within hospitals go, all the way from that, all the way to the most intimate form of interactive connection with patients at the bedside, which is in a small, private, and highly medicalized space. So we look at that full spectrum of different ways that musicians work in this environment, what some of the key creative challenges are in those contexts, and how musicians train for those challenges and execute projects. In addition to looking at examples across the country of different programs, we also look at some areas of new development and opportunities that we see on the horizon that we think are important to share. We also spend a lot of time talking about scope of practice, qualifications, training, and then we talk about the deep, deep importance of collaboration in this work.
Jill, Sarah, thank you both for illuminating the work that you do and for helping us understand this incredible path for musicians, especially during these really challenging public health times in which we find ourselves. I would also like to thank Robin McGinnis, Zane Forshee, Patrick Wallen, and Adam Scalici for their support today. I'm sorry we couldn't get to all the questions in the Q&A, but hopefully some of the materials that we will post after the fact will help you address those. As a reminder, these sessions will occur live every Tuesday at noon Eastern Time through the end of July. A full list of sessions, upcoming presenters, and previous sessions are available on the Peabody Keep Teaching website. As a participant, you will receive a follow-up email with a link to the recorded presentation and resources from today in the next couple of days. Following the session today, a brief survey should pop up in your browser. We look forward to your feedback and recommendations for future sessions and sincerely hope you will consider tuning in again. On behalf of Jill and Sarah and all the rest of us at Peabody, stay well, wash your hands, make sure you socially distance, and please enjoy the remainder of your day. Bye-bye.